Welcome back to EduSkills. OET made easy. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. All the services from EduSkills is free of cost.
Good evening, Father. Good evening to all. I'm Minnie Jackson, one of the OET aspirant in EduScale. Today, I'm going to deal with the introduction part of reading. So we'll move to the portions now. Okay. See, first of all, we need to understand that in the reading part we have three parts is there: A, B, and C, and 42 questions is there total. And under the A part there is a 20 questions and 50 minutes is there. Okay, and a total 42 questions we have 60 minutes. Then that will be a generic healthcare topic. Okay, then we'll move to the other strategies. Okay, or what are the things we need to focus. In part A, that is a one health topic will be there. That means the four text will be there: A, B, C, and D, that are interrelated. That is a one theme will be there. There is a whole the topic will be same, but there is a head subheading like definitions, signs and symptoms, management, or guidelines like that. Okay, that will be interrelated. Then 20 questions is equal to 20 marks. Each question 1 marks will be calculated. Then time is 50 minutes, but our target according to our edu skills or father's target, it's 10 minutes. Then type of questions. Okay, matching type questions is there, short answer questions is there, and sentence completion is there. Okay, and that means filling the gap questions. Or short answer question means we need to write the word or phrase. Then matching means we need to just find where which test it's contain the particular the questions. Okay, so we have to write only the ABCD in the 1 to 7 questions. Then expeditious reading task, that means fast reading task. Here we cannot wait for a long time. We need to be fast. Within the 15 minutes we have to complete the 20 questions. Then here there is a greatest challenge is there or enemy, that is a time management. And other one is a mistake, greatest mistake. We are focusing only for the grade B, but according to our father's strategy, we need to focus on the grade A. That is a expected grade should be grade A, and 450 to 500, that is a numerical score. Okay. Then one important thing should be focus, that is avoid focus mode. Avoid focus mode means don't spend too much time on the same question. Skip it and come back later. That means sometimes maybe we couldn't understand the question word, maybe hedging words. Okay, we didn't get the answer in the text. Okay, we will go on to hurry up or maybe tensed. Okay, so we'll go on to miss the and the meaning also. Then what we will go on to do, we will go on to keep a more time for the one question. So please don't do that. If just 45 seconds we can take for the one questions. If we cannot able to go for it, just leave it. Okay, then go to the other questions and come back to the when other questions will searching, that time maybe you will going to get that answer. So don't stuck on the one question, and please skip the questions if you don't know. Okay, then what are the skills should be assessed? Ability to skim and scan quickly across the different tests on the given topic. That means we need to understand that always we will remember that skim and scanning will be the same, but definitely this is different. Okay, skim means that is a jump. That means it's exactly we will going to jump to the particular topic to another particular, that is a important topics. Focus on the important portion or aspect to another important aspect. Then scan means we are going to deep into the text. That means as a medical professional, we know that while going for the scanning for the patient, we need the X-ray other than the other scans, okay, we can understand why we are preferring the scan. Okay, we'll go for the deep study about the condition of the patient. So same way we have to go for the deep study in the text. Then next one is an ability to locate specific information from for text in the quick and effective manner. This is a keyword is here, quick and effective. That means we need to focus on the numbers, percentage, body parts or procedure, whatever the importance information is given or highlighted, or we need to focus that. Okay, then the next one is an ability to understand the convention of different medical text type. That means four texts are there and we need to understand what is the interrelated. Okay, one topics the definition, next to causes or pathophysiology, then other science and symptoms. We know that what is the different stages in the portions. Okay, so we have to move on the or interrelated the portions. Then next one is ability to understand the presentation of numerical or textual information. Here we need to focus the same like in before the second option. We have to focus on the numbers and percentage. That means 0 to 9 means we need to write it on the words. Okay, that means 8 means we have to spell it EIGHT. We have to write it like this. Then 10 to 100 percentage means we need to go for it in the same like this, 80 percentage, 70 percentage. But while talking to the percentage in the numbers, we have to mention that percent. Okay, not a percentage. Okay, percentage 80%. Okay, so okay, then next one, what are the things we need to do within the 10 minutes? How to complete the reading within the 10 minutes. Okay, here another tips is there. Begin with the skim. Okay, already I told that what is a skim. Then that is a general idea for the question 1 to 7. Okay, according to the strategy, we need to write the answers from the 1 to 20. Okay, that will be easy for us. Okay, only maybe within 1 minute we can complete that 1 to 7 or seconds we can able to complete the answers. Okay, then second one is a focus on each text. That means topic main sentence is there, main topic sentence is there. Then according to the text, okay, we need to keep one headings. Okay, that is only for our purpose. We need to understand where the exact questions we can find out. Okay, so only for the our understanding purpose, we need to write one headings over the top of the paper. That is a question paper. You can write in the upper corner. You can write, or you can take it to a small pieces. While practicing time, you can use a small paper and write the four headings. Okay, then here just I wrote the example related to the fracture only. That is a text classification or definition or types, whatever you need to, you can write it. Then B, assessment and management is there. C, medication or drugs or treatment you can write. Then D, procedure, blacks, that is a procedure for the blacks of the. Okay, then next one is a skim for the skim. Again we'll come back and skim, search for the clues. Why we have to come back and do the searching means we have some kind of the strategies need to apply there. Okay, like hidden words is there or something is there. Okay, so we have to find how we can able to find. We'll go for the title, that is a main heading. Okay, that is a main heading, fracture, dislocation and sprain. That is a heading of the today's topic. Then section heading, if there is no heading, sometimes we couldn't able to find the section heading, it's just okay, leave it. Then other one is a subheading will be there, subheadings types maybe is there, or a classification is there. Okay, then next one, we have to find out some kind of the names, conditions, organs names. Okay, abbreviations. Okay, then why we have to focus? Because some of the answers will be the organs or conditions. Okay, then next one is a number or percentage. That is a, they will mention that some type of percentage or numbers, or they will going to see the write the medications, how long time, how many times we have to give. So each and everything they will mention in the percentage or number base. Okay, then sequential expression, that is a first or second or initially, like that means we need to focus there. We can understand that is a exact thing. The next one is a frequency, expression, time or duration will be there. According to the conditions based, we have to go for it. Then scale, already we know that almost, most, okay, never, a few, okay. This all the scale also we have to focus. Then adjective, that is a example I given, that is a constant pain. Constant pain means constant will be the adjective. Patient already have a pain, but there it's going to show that pain how it will be, okay. That is a constant, continuously patient is getting the pain. Then next one is a negative expression. Some words will be the negative forms, okay. Then we need to see that already last week we discussed about the listening part. We know that we are on the first method, okay. First method here also it's applicable. That is in the reading part we can use it. That is for saying and investigations, inquiry. The I means inquiry, R means reading, S for speaking out, and T for teleprinting or writing. Okay, this is a important method. We need to use it for the reading part. Then next one is 5 steps to crack reading part in 10 minutes. Okay. Here also steps one is a skimming. Already we discussed, that is identify or focus on the main heading. Focus on each text, that is write down the piece of paper or in the top corner of the each question paper booklet. Okay. That is a B or C, D. You have to mention like this. The step two means understand the relationship and the sequence among the text. That is interrelated. One to ABCD, that will be interrelated. We have to understand. Okay, because while reading the questions, we need to get the idea where it will be. Okay, okay. Sometimes some passages we can see that the management will give on the the B text, and again they will go to give to the D. Okay, so sometimes we'll get the confused. Okay, but we need to understand where it will be. Okay. Then third one is a skim for the text and highlight the clue. That is already clues already informed. Okay, that we have to highlight it. Then next, the fourth one is read the question statement and highlight and write the hedging words. Okay, that is a TQT method. We can use it. That is a while reading the already we know that the four headings is there. According to the headings, we will go into highlight the question also. Then that hedging words can use it for the other the conclusion of the exact answer. Okay. Then next one is a step 5, that is a match the keywords in the questions with the highlighted clues in the text. Okay, already we know that what are the points we kept there, and we will go on to search there. Okay, once you while practicing them, definitely you have to mention that ABCD in your question paper, so that will be easy. Okay, here you will going to take maybe 1 minute, then will not going to waste your time for to find the answer in the other side. Okay, so we have to focus on the reading. This is where this week at least this is my request. Okay, if you want to more confident in the part A, just to go for the introduction portion in thorough, then practice it. That will be definitely benefit. It's a from my experience, within the 1 month I gained to came to know this experience. Okay, so it's working for me, and please you people also do this one. Thank you so much.
Thank you, Minnie. You presented very slow and steady. With the past, you presented well, and your PPTs are very vivid. And in this introduction session, you highlighted the very few the things are 0 to 9 must be right in the words, and while we are presenting 80% means we should say 80%. And then main focus we are in the general ideas. Tips 1, begin with skim, and tip 2, focus on each text, and tip 3, skim, search for clues. You explained well in the 1 to 10 subheadings. It's very refreshing to us. And then you highlighted very elaborately about how to crack in part 1 and within 10 minutes. You are presented well. Thank you. It is really refreshing for everyone. Thank you, Minnie. Thank you for your effort. I would like to call the next presenter, Miss Sally, to present, Miss Versa to present the question number 1 to 5. Please take over the session. Good evening, Versa. Please take.
Yeah. Good evening, all. I'm Varsha, one of the OET aspirant from the EduSkill family. Good evening, Father and all. Today I'm going to present question number 1 to 5, procedure for delivering pain. Before going to these questions, as per Mini said, we should write the A, B, C, D according to the titles of the passage. So given here the A is the definition, B is the assessment and management, and C is the medication, and D is the procedures. So first questions, procedures for the delivering the pain. Here I will say the answer is C, but how it is C? As I divided 4 texts in the A, B, C, D. According to that, first answer is C. We go in the C paragraph where we can locate our answer. That technique, sorry, that given the medication, that morphine is for giving the pain relief. So the question is given for the pain relief, and we can write the answer, the C. I hope you understand the answer for the first and the second question. Second question is the procedure to follow the splinting a fracture link. Here hedging word, we will select the procedure to follow when splinting the fracture links. The answer is D. And if we go in the paragraph D, so what we techniques follow? Here the main techniques given for the fracture link is the slabs, and so the answer will be the D. In questions 3, here hedging words, what to record when assessing the patients. As we see, assessment and management comes in the B, that is the second paragraph, where the given assessment of the patients here shown the perform standard clinical observation and examine the records. Answers for the third questions. Here the examine and records mean note down the meaning of that paraphrasing. So that is the answer for the question number 3. And for the question number 4, the hedging words, the terms used to describe different types of fractures. So we can get the idea, the different types where it is located. The the paragraph number A. You can see in the paragraph A where they have mentioned the close fracture. In under the fracture, they have shown the close fracture where the skin is intact, and compound fracture where there is a break in the overlying skin. That is the two different types of fracture they have given. So we can give the answer A. And for the question number 5, the practitioners who administer anesthesia. It is easy to understand the anesthesia part. It is the drug part we are giving for the pain, and it is located in the part C as a medication we marked already. So we can directly go in the C part where it has given the authorized indigenous health worker must consult medical officer or nurse practitioner, schedule the medicine and medicines, rural and located, isolated practice register, nurse may proceed. So here who can give the answer is indicate for the question number 5, and according like that we can get the answer if we can mask the text according to ABC. It will be easy to understand actually where it will be the located our answer.
Thank you, Varsha, for your well presentation.
Yeah.
Then you explained well in the hedging word, and the hedging word, how it is paraphrased, and what is the interrelationship between the 4 texts. You explained well. Your presentation was very nice. Thank you. I would like to call next presenter, Ms. Shali, to present the question number from 6 to 10. Please come forward and present your questions. Thank you.
Good evening to all. My name is Shali Thomas, an OET aspirant from EduSkill International. I would like to thank for Father Salim Joseph and all admin members. Today I am going to present reading part A. Test is fractures and dislocation and spray. In reading part A, we have 5 principles of skimming in the reading part A. First one is main heading or main topic. Second, focus, subtopic of each paragraph or test. Third, keywords, phases of each paragraph. 4, stem words or keywords of the question statements. 5, synonyms, language and paraphrasing in the test. When we know the question keywords, we can identify the answer easily. We need to identify the main heading of the topic. Here, main topic is main heading and main topic is fractures and dislocation and sprint. Find out the keywords in the each questions. Then focus subtopic of each paragraph or test. Then we can see the test A, classification, definition, course, types. Test B, assessment and management. Test C, medication, treatment. Test D, procedure, plaster, backslab. And next one, keywords or phases of each paragraph, main heading, subheadings. Reading part A, there is strategies and tips. Step 1, skimming for general ideas. Once you skim the, we get some ideas from general idea from the test. Step in, we need to look for main heading, main topic. Here, main topic is fracture, dislocation, sprain. Then, second, focus topic of each test. Test A, classification, definition, course, types. Test B, assessment and management, diagnosis. C, treatment, medication. D, procedure, plaster, backslab. In the reading, there is a synonymous language they using. In this topic, in the question, they use some synonymous language. In the question, causes, test, occur, getting bigger and swelling, pain relief, morphine, injured limb, fractured limb, leg, injuries, fractures, upper limb, arm, elevate the limb, elevate the fractured leg. Then moving on the question. In which test can we find information about? Question number 6 here. What to look for when checking an injuries? The answer in the B. Then here they use some synonymous language checking an injury. We can see in the test B in assessment and management. Here, immediate management is there, clinical assessment is there, examine. They use some paraphrasing sentence, examine. In the question, they ask checking an injury. We can see in the test B, examine, checking whether management. Move on the 7th question. How fractures can be caused? Answer in the A, there in A, classification. We can see in the test A, there is a classification, definition and cause, types. Here also they use some word. In the question, they use in the cause. In the paragraph, we can see occur, often occur following direct or indirect injury. Then moving on, 8th question. 8th question, complete each of the sentence 8 to 14 with a word or short phrase from one of the test. Each answer may include words, members of both. In the question 8, what should be used to elevate a patient's fractured leg? The answer is a pillow. This written in the test B. A pillow for leg injuries. We can see in the test, the management there they written They're using the pillow in the test. Moving on, the 9th question. What is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? Here they are asking for maximum dose of morphine per kilo. They are asking for kilo. Then moving on, that answer in the C, treatment, medication. We can see in the recommended dosage, adult only, intramuscular 0.1 to 0.2 mg per kilo to a maximum. Answer is 0.2 mg per kilo. Moving on, the next question. 10. Which parts of a limb may need extra padding? This answer in the test D. We can see in the last sentence in the test C. Extra padding can be placed over bony prominence. Answer is bony prominence. This way we can identify the reading part A answer. These all strategies for our father strategy. I started to study 1 month here. I follow these strategies. I improved lots. Thank you.
Thank you, Ms. Sally. You presented well, and then you highlighted the principles of 5 skimming principles and then your strategies, and then the words which are how it's paraphrased, well presented. Your PPT presentation is very nice. Thank you. Once again, thank you. Next, I would like to call Ms. Nitya Binil to present the question between 11 to 15. Thank you.
Thank you, Sudha. Good
Thank you.
evening, all. First of all, I would like to say my sincere thanks to our father, Salim Joseph, and all admin panel members for this wonderful opportunity to improve our learning. Okay, today I am going to deal with the reading part A. My questions are 16 to 20, not 16, 11 to 15. Prior to going to the question, I want to say how to find out the answer. All the members, beginning members, they already told all these things, but I want to say again this because without this skill, we cannot identify our answer. Today, our topic is fracture, dislocation, and sprains. When we take our text, we have to go to the skimming. What is skimming? Skimming means just we have to run to the main points. Our topic is fracture, dislocation, and sprains. We have to underline when we look at the heading. And first of all, when we see this heading, we have to think, we have to predict what all are the factors come under this heading. Then we move to the text heading. Just underline all this text heading, and subheading also we have to underline. Then we have to underline each keywords of this each text. After these keywords underline, we have to create our own headings. What are the things we have to underline? That is, father already taught: names, sequential expression, frequency expression, negative expression, numbers, percentage. All these things we have to underline. And finally, we can make a name of this particular paragraph, particular text, if they are not given in the text. So in this text, first text is the A. They are not giving the name. So we have to derive, that is the types of fracture they are giving. So we have to derive, and we have created types of fracture, that is classification. Like that, we have to create one heading. Then move to the text B, and we can understand they are giving immediate management, clinical assessment, and management. In the subheading is a simple fracture of limbs. Then we can assume that something related to limbs, and the assessment and management related to limbs we have to understand. Then we can just make the headings of assessment and management. Then we move to the next text, that is text C. In this, they are given drugs related to the fractures, that is morphine and something is there. We just underline these keywords and we have to create one heading, that is the drugs related or medicine, whatever like and related to that, we have to create one heading, that is the text C is that heading. Then move to the text D, that the plaster black slab procedure. Then all the things 1 to 8 procedure is the written related to this procedure. So we have to write the heading like this procedure or something, whatever like that. We have to make the heading. After that, when we move to the question section, we have to write these headings in our question booklet A, B, C, D, that is classification, assessment, medication, procedure, like that we have to write in that question booklet. Then we have to underline, we have to read the question and underline the hedging word of the question. My questions are 11 to 14. 11th question is, what should be used to treat a patient who suffer respiratory depression? And from this, what we can understand, the hedging words are what should be used. Something is used for something. And respiratory depression. Something is used for respiratory depression. And what we can understand, in this respiratory depression, some treatment or something is used. And we can just go through the headings. In this classification, it won't come. And the management, and we think it is whether it come to the management. Okay, it might be in the management. Sometimes it management it might be thing, but they're asking what should be used in the particular medication or like that. Then the medicine is written in the text C. Then we can assume that it might be in the text C, and we roughly write near to the question the text C roughly write, and then move to the text and we have to analyze, that is we have to do scanning and we will get the answer. Then next question is, what should be used to cover a freshly applied black plaster back slab? And from this question we can understand that plaster back slab is mentioned in the text D. So we immediately write near that question, and D might be the paragraph, that is the text. Then next question is, what analysis should be used to what analysis should be given to the patient who is allergic to morphine? Then the allergic to morphine, never take only the morphine. Allergic to morphine, that is the keyword we have to underline. Then analgesic also underline, and then we have to think in where it might be. It might be the possibility is in the B paragraph, B text, and we have to write that is in the B text. Then next question, what condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia? Then we have to underline what condition and splinting, elevation, and repeated analgesia. This splinting, elevation, and repeated analgesia is come under the text B. They are telling assessment, management, and all these things are dealing in the text B. Then we have to write just simply in the near to the question, that is the B, text B. Then next question is, the falling on an outstretched hand is a typical cause of a dash of the elbow. That is the something related to the cause. These cause are only they are telling in the part A. The remaining text are dealing with the management, medication, and procedure. So we can assume that it might be in the part A. Text A. So we have to write that is in the text A. Then after understanding whether these questions from which text, and it is very easy to understand, very easy to find out the correct answer. So then we move to the particular portion of the text. After finding the which text, and we move to the particular portion of the text, and we have to read very deeply, that is the scanning. And from in the prior we have underlined all the things, that is negative expression, frequency expression, sequential expression, everything we underlined in the 10-minute session. and not 10 minutes, 2 minutes skimming session. And in that, and when we go back to the text, we will catch this answer easily. In the 11th question's answer, it is in the text C. And in the text C, it is the last portion. They are telling the last sentence is respiratory depression is rare. Rare is the one negative expression is there. Then if it should occur, give naloxone. And that is the our respiratory depression is the correct word is there from the question itself. And then the answer is naloxone. What should be used to treat a patient who suffers respiratory depression? And the answer is naloxone. It is already written. Then the next question is, 12th question is, what should be used to cover a freshly applied plaster back slab? And the 12th question answer comes under the D text. In the D text, they are dealing in the complete procedure of plaster black slab. And the 8th one is the wrap crepe bandage firmly around plaster back slab. And the cover, the synonym is the wrap. And the plaster black slab is same, the same word is in the text also. So it is very easily to locate the answer. Then the next 13th question is, what analgesic should be given to a patient who is allergic to morphine? It is the allergy related things they are telling in the text B. And the text B, the last portion, and in this, administer analgesia to patients in severe pain. If not allergic, give morphine. If allergic to morphine, use fentanyl. And this is the correct answer is there. There is no confusing in that. So it is very easy to locate. Then the next question is, what condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia? This can be seen in the B text last portion. Consider compartment syndrome when pain is severe and unrelieved by splinting and elevation or 2 doses of analgesia. So what is the condition? They are asking the condition. So we can select from this sentence, the condition is compartment syndrome. If this pain is severe or the splinting or elevation that is not happen, then compartment syndrome we can consider. So the condition is a compartment syndrome. And when we move to the 15th question, falling on an outstretched hand is a typical cause of a dash of the elbow. That is in the text A, dislocation, type of the fracture dislocation portion, it is there. In the dislocation is where a bone is completely displaced from the joint. It often results from injuries away from the affected joint. Example, elbow dislocation after falling on an outstretched hand. The paraphrasing of this sentence is the question. Falling on an outstretched hand is a typical cause of a dislocation of elbow. That is the cause and effect language that is used in this question, and just paraphrasing. Then the elbow is already written, so there is no need to write the elbow in this answer. So answer is dislocation. Okay, these are our answer. These are the way to find out this question reading part A. If you follow these strategies, it is very easy finding the location of the exact text. That is the difficult process. After that, it is very easy to find the answer. So from my experience, I understood consistent practice is the key, and if you do consistently, and we can apply this skill very easily. So I hope everyone understood. Thank you for giving us such a beautiful chance. Thank you, everyone.
Thank you, Ms. Nitya. So you highlighted the keywords. What are all the things while highlighting? What are all things we need to check? Heading, adjective, negative expressions, scales, and so on. And then you explained the negative expression, and then synonymous language, and cause and effect, These are all the things you are highlighted well and you are well presented. If we are confusing how to differentiate the bandage and medications, it was very nice, and definitely we will do consistent practice. We will achieve our goal. Thank you. I would like to call next person, Miss Annie, to present the question number between 16 to 20. Please come forward and take over the session. Thank you.
Thank you. I am Anjos, one of the OET aspirants from Schools International. First of all, I thank Father Salim and all admin panel members for giving me this opportunity. Today, I am going to discuss about question number 16 to 20. As we know that part A comes under classification, part B, assessment and management, part C, medication, part D, procedure, plaster, backslab. Let's find out the keywords from the question. Question number 16. Upper limb fractures should be elevated by means of a dash. Here, keywords are upper limb fractures and elevated. Upper limb means arm, should here used as a model verb, and it is used for giving advice, suggestion, or recommendation. And next keyword is elevated. Elevated means here management. So, how can we find the answer? In part B, the main heading is simple fracture of limbs and subheadings are assessment and management. So here the answer is from the text B. Let's analyze the text. In the text, we can see that elevate the limb, a sling for arm injuries. Elevate the limb means elevate the fractured arm. Here the synonyms language is being used here, and injuries means arm injuries means arm fracture. So here the answer is sling. Upper limb fractures should be elevated by means of a sling. It comes from text D and the answer is sling. Next question number 17. Question number 17. Make sure that patient is not wearing any dash on the part of the body where the plaster backslab is going to be placed. Here hedging words are is not wearing and plaster backslab. Is not wearing is the negative expression is here used. And we know that the plaster backslab is comes from text D. So in the text we can see that ensure any jewelry is removed from the injured limb. Let's analyze the question stem and the text. In the question, it's mentioned make sure, but in the text we can see that ensure. In the question we can see that it's not wearing any, but in the text we can see that is removed from. So here the answer is jewelry. Here we can say that negative expression, and keywords are is not wearing and plaster backslab. The answer is from the text D. Then question number 18. Check to see whether solar limbs are dash or increasing in size. Here keywords are check to see and solar limbs, and also or conjunction is used here. So as our father strategy, if you find any conjunction, you need to be marked. You may get answer from those expressions. Example, wounds or swelling, nausea and vomiting. So here we can see that keywords from the text B. That means it comes under assessment. So in the text we can see that the limb if swollen is throbbing or getting bigger. Here the answer is throbbing, and in the question we can see that increasing in size, but in the text getting bigger. So here the synonyms language is used here. Then question number 19. In a plaster backslab, there is a layer of dash closer to the skin. Here the keywords are plaster, backslab and layer. So we know that it comes from text D. Here the text we can see that measure length of non-compression coated stockinette from halfway up the middle finger to just below the elbow. Here it's not a direct question. here we need to visualize the procedure. So it's easy for us to locate the answer. And also from the second sentence, we can identify that wrap cotton padding over top for the full length of the stockinette, 2 layers, 50% overlap. That means first we need to apply stockinette. After that, we need to apply cotton padding. So stockinette is close to the skin. Here the answer is stockinette. Then question number 20. Patients aged dash and over shouldn't be given the higher doses of pain relief. Here the keywords is dosages of pain relief. It comes from text C, treatment. In the text, we can see that use the lower end of dose range in patients greater than or equal to 70 years. But in the question, it's given us patient age 70 and over. So here we need to write the answer only 70. And also here we can see that higher and lower, these are the scales we can see in the answer. So I hope it's clear to you. Thank you.
Thank you, Anit, for your wonderful presentation. In your presentation, you highlighted the model verb, synonymous language, and negative expression, and then importance of marking the conjunction, and then scale words. You explain and slow and steady. Very nice, your presentation. Thank you once again. I would like to thank all the presenters, those who presented. You put your maximum effort. Your classes are very nice. Thank you, one and all.
Thank you, Sudha, and all the participants. Sudha, you coordinated well.
Thank you, Helen. You are the striving force for me.
Thank you. God bless you.
Thank you.
So I know many of them are afraid of preparing PPT and presenting class, but don't be afraid of anything. We all are new to these things. Technically, I'm also very poor, but the thing, if we have a mind to study, we can achieve anything. God's grace is there, and our mentor is giving us full support and everything from our means from a great level. Father came to our level, and he's doing a great work for me and for each and every one of us. So thank you, Father, for this wonderful opportunity, and I request all aspirants to use this platform. Actually, it is absolutely free, so use the services. If you have any queries regarding the discussion, you can approach me. And in 2025 batch, there are slots for this whole week. You can take your slots according to your duties. Thank you all. We can wind up today's discussion.
Thank you.
Yes, Helen is rocking. Everybody is rocking. Anyhow, everyone did it well. Great effort. And I know this is the way to learn. You may find it a bit embarrassing or a bit challenging in the beginning, but this is the best way. I am so happy, proud, and jealous how people can understand the strategies. Don't worry, don't prepare. You don't need not even prepare PPTs. You can just highlight in the text, take a screenshot, and share it to the person who is coordinating. Now, as of now, Minnie Jackson. Did you understand? You underline the main point keywords with your sketch pen or whatever the pen you want to use in the hard copy. Take a photo and send that photo. That will be enough. They'll share it in the screen. Means for the common people, it's only for the learners. You are not presenting it for experts. You are presenting it for the OET learners. And they know the text is there. They can understand better when they see the text highlighted and all that. Then they will start doing it.
No.
Yeah, Helen is so happy.
Yes, Father, I'm happy.
Hi, everybody. No, that will give you clear understanding because you will plan and work out and study very deep when you have to teach. That will give you clarity. Otherwise, you'll be just going on and on. You may not absorb it fully. And whatever is given in listening part A, that is exact model of your speaking test. The questions asked there, you play the role of a professional in the speaking text. So if you understand better and do well in listening part A, speaking will not be an issue for a all. See, you will never have a platform like this anywhere in the world, where you get these chances. And the thing comes free of cost, I tell you. Even this platform, we have to pay 17,000 rent. Otherwise, you get only 40 minutes. Okay, so utilize those. We are spending on it. You are getting it free. So make use of it. When one nurse called Soumya Sham thought of helping 4 people, now she has helped lakhs of people, maybe within 5 years, thousands and thousands. So everybody can do that.
Okay, thank you so much. Thanks for your help. I'm following your strategies and I think I'm improving a lot now. So this is a very, very, very good platform. I really appreciate everybody's uh, everything they are giving to us. So great. Thank you. Thank you all the admins and especially thank you to you.
And I want to tell you, my EduSkills YouTube channel has more than 300 videos. You will never ever find such resources. But the full explanation, you have all the 4 modules, all the strategies explained in different videos. Definitely, you can access them. They are all free. If need be, I will give all the links together in a single form, and you can just click on the links and reach the videos. If you watch them all, definitely I know you will not come here to listen to me because I have talked almost everything over there. Those are not just videos, they are the previous sessions uploaded. Previous Zoom sessions uploaded on 4 subtests. Like we have contrast word based questions, you have gist based questions, you have topic sentence based questions, you have detail based questions, which is in the supporting sentence, opinion questions. All those are the different types of questions. There are different criteria. Those things also I have explained in my channel. And there are typical types and only such types will be asked.
Thank you, sir.
If you find my smile attractive, we'll meet again.
Thank you, Father.
Yes.
Thank you, Father.
Thank you, Father.
Thank you so much, Father.
Thank you,
Yeah.
Father.
Thank you, Father.
God bless you all.
It was very interesting and very, very, very informative session. And thank you so much for taking some time out of your busy schedule. Thank you so much. God
You're
bless you.
most welcome.